let's take a moment and look at the tooth chart that you have at your left. Were you exposed to that first by Eversol, or this is a little more elaborate than most of the ones that I've seen?
Yeah, this was given to me by a patient who's been to the doctor that put this together. There's several tooth charts out there. George Eversol originally exposed us to the work of Dr. Reinhold Boll from Germany, who developed the Dermatron machine.
The EAV,
That was
electroacupuncture, according to Vol.
Yes.
Okay.
He came up with the tooth chart. There may be similar to this. I haven't compared them. And there's also Dr. John Rao in, I think, it's Switzerland, who developed a tooth chart also. But all of them seem to be relatively close to one another. I don't know if it's set in concrete that everything's just the way the chart shows, but it does give you some good indications very often you can very often do muscle testing to correlate a tooth problem with an organ situation. I've done this with the bite very often. Find that if you've got your bite balanced correctly, the organ systems seem to normalize. So, quite frankly, the more I've learned, the more I realize I don't know anything. Because trying to figure the body out is complicated. It's simple but complicated at the same time. But the tooth chart does give you some good guidelines to go by. Again, everybody's not affected by the same things. You can have a problem with the tooth but not have a problem with the organ. Is the organ problem causing the tooth problem? Possibly.
Do any instances come to mind where an organ issue was resolved and then you saw a tooth issue resolve?
Well, I think the thing I've seen most of all is very often when I see a new patient who has issues, we always check their bite. And I do muscle testing on them usually to see what organ systems may be out of balance. Not having any lab work or any quote medical knowledge about the organs themselves, only what you see muscle testing wise. I have learned how to evaluate the bite and see if that may be causing a problem by simply putting a piece of paper between the teeth and having a bite on it and see if that normalizes the muscle imbalances in the body. Very often it does. That just gives me a way to evaluate, to know what maybe is the first thing needs to be done. I've come to realize that perhaps if your bite is off, the basic foundation in your mouth is out of balance. It's kind of like trying to build a house on a foundation of sand. So I've learned that if you can stabilize that whole process and normalize the organs of what I assume would be normal, that things will function better. If you're going to remove mercury fillings, for instance, the body needs to be able to detoxify that. And one of the organ systems is the kidneys. And if the kidneys are out of balance, if there's something going on, you start taking mercury fillings out of the mouth, you may cause a toxic reaction in the body, which may not be too comfortable for the client. So that's the first thing I always do. So that in the liver.
So you're saying you check the kidney and liver to make sure that they're in balance before you would consider taking out.
What you assume is in balance if their muscles related to those organs are weak or strong.
Yeah.
Before you take anything out of their mouth, because you don't want to overload their system because they'll get sick. And you can make people sick very easily if you're not careful.
Yeah. So you're saying, let's say you evaluate the liver kinesiologically, and you find
kidneys, the digestive system.
Yeah, let's just say hypothetically you find a fault, say in the liver,
right,
and you notice an area, a tooth that relates to the liver may have some issues, by just taking a little strip of paper, which kind of acts like filler, so to speak, you have them bite on that. And if you notice that the muscle response related to liver strengthens, that would suggest you that there's a bite or a structural issue that's activating that tooth and therefore
Right.
arcing into affecting the liver
That's
per
correct.
se.
Yes.
Now, let's say you have a cavity in the tooth that's related to the liver, putting a piece of paper in there, that's not going to change it, or would it?
No.
Okay, so it's only if it's like a structural issue versus a pathological
Right.
development that way. But certainly restoring the tooth to a more sound state, either,
Well, that's appropriate. I mean, that's
That-
the problem. You can't leave the pathology in the tooth, or you'll end up with a problem.
and that's where the tooth could be actually creating the liver issue, and that's where this chart kind of creates a little map that way. And okay, and so you'll evaluate the body and look at the mouth. You'll evaluate the mouth and go out to the body. You see it's kind of a two-way street.
Right.
And so these charts just kind of help open you up, give you a little bit of a guide.
It gives you a guide to where to possibly look.
Yeah.
You have people who may have a problem with an organ that may not be related to the tooth on the tooth chart. So again, it's just a guide. You almost need to be a fly on the wall to really, inside the body, to know what's really going on.
Yeah, I find a lot of times I'll ask a patient a question because I'm not a fly in the wall. And they're like, well, I don't know. Like, well, you live in your body 24 hours a day. I don't have the advantage of that. You've got to help me out here.
Right.
You know, what are you noticing and such? Well, let's jump to another topic that has a little bit of controversy surrounding it, and that's fluoride. Give us your thoughts on fluoride rinses in the mouth, fluoride in the water, fluoride toothpaste.
Fluoride generally is a toxin. It's been proven to be so, and if you read the research that's done on it, it's a byproduct of the aluminum industry and also the fertilizer industry, and it's very toxic. To use it as a mouth rinse may be fine if you don't swallow it. It's been proven to, quote, reduce tooth decay, but sometimes people have fluoride issues. My daughter, for instance, when she was younger, had kidney problems, and her teeth started to mottle because I had her on fluoride like any good father and dentist would do, and as soon as I took her off from fluoride, oral fluoride, she quit having kidney problems. A lot of people have patients who have allergy to fluoride in toothpaste. It makes their gums really sensitive. So here again, it's a matter of an individual process. Fluoride can cause your muscles to get hardened. More bone fractures when you get older. The Manhattan study done many, many years ago proved that fluoride is toxic. So it's a big magic bullet in the eyes of dentistry. Fluoride in the water, I think that's a political problem, and it's a choice problem. You should be able to choose whether you want fluoride or not. The American Dental Association, or the Pediatric Association, has said that you should be careful about prescribing fluoride to people now because there's fluoride in the water every place, and you can overdose people with fluoride. I think it comes down to your own belief system. I don't think it's healthy. I don't use it in my practice. Some filling materials do have some fluoride in it. That apparently is not a problem. But I don't do fluoride treatments in my office. I used to do it all the time, and kids would get sick and throw up, and I got tired of that. I'm sure it was because they were allergic to the fluoride.
Well, you may recall this conversation with my wife Megan and I. When she moved down here 3 years ago from Portland, where they do not fluoridate water, she immediately started having neck issues, and as a chiropractor she was asking me to adjust her neck, and she'd get some relief, and then it would come back, and we would travel away and drink bottled water, and her neck would be fine, and we think, oh, the adjustment took care of it, and then we'd come back and she'd get her neck pain again. Finally, after this cycle had went on a few times, she asked me to adjust her, and I went to adjust her, and I felt like the Wicked Witch of the North going to touch Dorothy's shoes. When I went to take my hands towards her neck, her body just yelled, "Hey, idiot, quit adjusting her neck, that's not the issue." And immediately I just got a sense about her thyroid, and we kinesiologically assessed her thyroid, and sure enough, there was an issue there. And so we rebalanced her thyroid, and then we started wondering, why was the thyroid referring pain to the neck? Why was the thyroid acting up? And we'd been studying iodine recently, and how it's a halide, and how its atomic weight is low compared to chlorine and fluoride. And the municipal water here has both chlorine and fluoride, and what we were able to conclude is that the fluoride and the chlorine were displacing the iodine and creating stress in the thyroid. And so once we got her completely off of fluoridated water, she doesn't have a problem. If we go someplace and she accidentally gets some fluoridated water, and we've had this happen a couple times where we weren't aware that she was getting it, and sure enough, it's popped up again. So, have you ever had anyone else talk about fluoride and the thyroid and neck pain?
No, but I know that's a problem. A lot of people have fluoride or thyroid problems, so it makes you wonder whether that's one of the causes.
Yeah, it immediately just kind of made me think, wow, how many people are out there, dealing with autoimmune thyroids and other, conditions that might be related to that. One last thing before we change topics just a little bit is anesthesia. Now, I have had impaired detoxification pretty much my whole life. That's been something that I've worked on and made some headway with. But when I was 12 years old, and I had some dental work done, and the local anesthetic lasted for a week on me, and I just thought, it's just not worth it. I'd rather just hurt during the dental work to not have to have a numb face for an entire week. I remember specifically my lips, and I had a girlfriend at the time, and I couldn't feel anything when we kissed, and and I didn't know it lasted a week. I didn't know if it was going to last for a year.
Right.
And so I started asking dentists to no longer use that, and then nitric oxide would make me sick, because I had a hard time detoxing that. So I didn't want to do the laughing gas. And I remember the first time I had dental work done with no anesthesia. Yes, it hurt like the dickens, but when I walked out, it was over. It was done. The dental work stayed in the office. I left the clinic, and I was fine. I was able to just go about my day, and I'm like, wow, that's worth $1,000 right there, to not be sick and not be able to feel and wonder how long that's going to happen. So you introduced me to, and I started having you do dental work with me, of just slowing down the drill and using a lot of hand tools to carve out decay and things like that, which I really appreciated. The previous dentist really didn't do that so much. They pretty much did the normal thing, and I think maybe it's you that shared with me, it's the speed of the dental drill creating heat that produces a lot of the pain in dental work, that it's not necessarily all just straight sensitivity from the pressure and the carving out itself, but it's that heat that gets generated. Have you had many other patients that you haven't used anesthesia with? Do you think it really matters? It's just a patient preference? Does it make it harder on you as a dentist? I know sometimes it looked like you were in pain along with me, and
It makes it harder on the dentist, at least it does on me. Actually, since you brought all this up, I'll just have to tell you my history a little bit. First of all, I started using nitrous oxide. I was one of the first dentists in Utah to use it, one of about 6 or 8. I used to go home from work totally exhausted, and I realized that I was picking up the patient's fear. There's very few people who like going to the dentist for the various reasons, one of them being a numb face, whatever. Nitrous oxide helped alleviate people's fear, which helped alleviate my stress considerably. But I used to use anesthetic that has epinephrine in it. And I started having people have reactions to that. Epinephrine is one of the things that creates
Okay, so you're talking about
the anesthetic that has epinephrine in it, which is similar, has a similar reaction in the body to adrenaline, which creates the fight or flight response in the body. One day I thought, I had people who would, after an injection, would say, "Oh, my heart's racing." I realized it was the epinephrine in the anesthetic that was causing this problem. So I quit using anesthetic that had epinephrine in it, quit having people have anxiety problems from an injection. I also realized maybe one of the reasons people fear going to the dentist is because we literally inject fear into them through the anesthetic.
Yeah.
And so have stopped using that many years ago, but also was made aware of homeopathic remedies that I give patients anymore to help the liver detoxify the anesthetic so it doesn't last very long. And that also helps. You brought up having your lip numb for a week. Well, it's not pleasant to have your face feel paralyzed even for 2 or 3 hours, and so the homeopathic remedies cut down that length of time too, so that helps if you have to use anesthetic. It's very difficult, I think, for most dentists, I don't know everybody, at least for me, to inflict pain on people, and if people manifest that they're having pain when you're trying to fix their teeth, it's very difficult to do an adequate job because you're afraid you're going to hurt them. In your case, they don't feel that anxiety so much as most people are extremely sensitive in their mouth.
Yeah.
And some people are very demonstrative of feeling pain, and that makes it so you can't really do an adequate job.
So your preference is to use anesthesia, enough anesthesia where you can relax, the patient can relax, and you found if you use the lidocaine.
I used lidocaine, which had epinephrine in it.
That would create problems you didn't want to bring up.
Right.
What are the ones that
I use carbocaine or isocaine now with 3% isocaine, which has no vasoconstricting agent of any kind in it.
Okay.
The epinephrine is in the anesthetic, so that it will constrict the blood vessels so that the stuff will last longer. So it'll last for 2 or 3 hours. Sometimes we have to give people 2 injections, but even that's enough to get through the procedure, so they aren't numb for hours after, and they don't have a reaction to epinephrine.
And as far as the nitrous oxide goes, has that been problematic in any way, or you've
That's
found
never
that
been.
people?
The only problem was when I first started using it and had no experience with it, I had a couple of children who threw up all over the office. Learned, number one, I gave them too much. Number two, they had just eaten a big breakfast. I've learned over the years.
Not a great combination.
No, it's not a great combination. And people who get motion sickness either can't use nitrous, or you have to be very careful. Nitrous has been a great fear-reducing agent for a lot of people and makes it possible for them to have dental work done without feeling the fear of it all. I've had many cases in the past where just using nitrous has been all the anesthetic they really needed. It made it possible so that they could have their teeth fixed with no anesthetic at all. They maybe could feel something, but they didn't care. And in my eyes, the beautiful thing about nitrous is you can give enough oxygen after the procedure to clear the body of all the effects of the nitrous so people can drive after they've had it, as opposed to having some drug that they have to allow hours to wear off.
So you switch to 100% oxygen, or?
Yeah, you switch to 100% oxygen after you get through with the nitrous, because it's heavier than nitrous, it'll flush all the nitrous out of the body.
And that's probably not something you knew in the early days, or did that
Well, we
come
did,
out right away?
but it's just a matter of finding out the exact amount that the people can tolerate.
Yeah.
Everybody has a different amount that they can tolerate, and when I first took the course in nitrous oxide, I got too much the first time we did it. Nobody had ever used it before, and it was a scary experience. But something in me said, this is something that could be very beneficial. I grew up with this kid not having anesthesia to have my teeth fixed, so I knew what that was like, and I also had the opposite of having anesthetic to have my teeth fixed, and it was a huge difference for me, at least.
Yeah.
But I realized after I got introduced to nitrous that I wasn't so stressed by the end of the day. And I realized that, so I was picking up what I assumed was people's fear.
Just your empathy and if nothing else.
Right.
And having been your patient, generally the pain of the dental work itself has been pretty tolerable. It's challenging. I think one time you had to go through my tooth to get to the decay, and that was a little more challenging. But I found with me what has been more difficult, and I don't think I've ever really talked to you about this, is just the jaw spasms of having my mouth open for a long time. Had I mentioned that to you? Is there something like you could have done, or is it a matter of just stopping and relaxing every now and again?
Well, I'm guilty of this many times. There's a mouth prop you can put in the mouth, so the patient can bite on that to help them stabilize their jaw. Quite often I don't think about that unless people say something.
Yeah.
Because it's some people, everybody's different. Some people can tolerate something like that. Some people can't tolerate it. It's just one more thing they've got to deal with. Again, it's an individual thing, and it makes the practice of dentistry challenging because you have to become aware of everybody's idiosyncrasies if you can, and try to cater to that.
Yeah. We also shared a patient that she told me when she came in and saw you, she would, in her mind, draw a circle around the tooth that you were working on and tell her body there's no pain inside of that circle. You might even remember the patient I'm referring to. And so I came in and I tried that, and it didn't really seem to work for me. But she really had great results. I was envious of that. Have you had others, and any thoughts on using self-hypnosis?
I think some people have done self-hypnosis of some kind, or whatever you want to call it, to deal with the pain. There are some people who don't like Novocaine, and there's not very many of them. They don't like getting the injection. No one likes that. I had a nurse once who said it's always better to give than receive.
Yeah.
But I think some people who have trained their bodies, more like women that do childbirth without any anesthetic at all, they've learned to focus their mind in someplace else. So, but that's not the rule. That's not real common.
Yeah, I had ankle surgery without any anesthesia a few years back, and what I do when I get in a painful situation is I sing. And so the anesthesiologist stood next to me and he's like, I'm here, so if at any point you want anything. But the whole staff that was there in the operating room had to put up with me singing Elton John songs and some religious songs, and just that's what kept my mind, someplace focused, which I guess was a form of hypnosis too. But you don't know of any, I'm curious, are there any like books written on like self-hypnosis for dentistry? Anything comes to mind that way?
I have
Yeah.
no idea.
Yeah, it would be an interesting topic for someone to tackle. Okay, let's go ahead and pause.